Hello and welcome to RXperts podcast. I am Carol Matichka, your host, bringing you fascinating perspectives from the world and realm of pharmacy. Hello, everyone. We are so lucky to have with us today two pharmacists from Thailand. So I would like to welcome to the show. We have Wam and Molly.
Hi.
So they are visiting us to see what everything is like in the U.S. compared to Thailand in regards to education of pharmacy and pharmacy practice. So they've been sharing their experiences with some of the practitioners here as well as our students. So I'm excited to talk to you all, the audience, as well, to give a little bit of information. Yeah. So, okay, well, let's start with the first question. Yes. What do you do in Thailand? What is your specific practice? So either one of you can answer.
Specific practice?
Like, what do you do?
Yeah.
You work oncology,
yeah.
correct?
We have to feel, for me as clinical pharmacist, we have practice with our patients, but one is
dispensing, yes, pharmacy.
Okay.
Yes, to verify the order, the prescription, and to dispense and counseling. Yes.
Perfect.
Yes.
So you are a community pharmacist, and you are a pharmacist mostly in oncology and
hematology.
In hematology. Okay,
right.
Perfect.
Yes. My specialty is bone marrow transplantation.
Okay.
So I spend more time in the ward with my patient, take care of their like protocol drugs, chemotherapies, and immunotherapies.
Okay, yes. Great. And what differences do you see when you're taking care of patients in Thailand compared to what we do especially in your field? And then I'll ask you too, but we'll ask you first. Who wants to go first?
Yeah. In outpatient pharmacy, the role of pharmacist is for verify the order first. So, but in US, the technician can review first and send the order to the pharmacist.
Oh, so the technician can't verify orders at all.
Yes,
okay,
it's different,
and put them in
to dispensing the medicine. So in Thailand, we have to do must be the pharmacist to dispense the medicine to all of patients.
So dispensing everything is the pharmacist.
It's involve patient, yes.
Right, okay. So then what does the technician do?
The technician
in Thailand
refill the medicines to inventories and prepare the medicines and check for expiration.
Okay.
Yes. And use in compounding medicine, yes.
Help pharmacists
compounding the compounding. Okay.
Yes.
And then, of course, like you said, checking inventory, stocking inventory, checking for expiration.
Yes.
Okay.
To prepare the medicines, yes, before we shaking and dispense.
Okay. And how about you? What do you see as differences?
Difference. Exactly, acute care is quite the same.
Okay.
I also roll with my multidisciplinary team every day in the morning, and maybe get clinic in evening or get consultant from anyone nurse or our doctors, but especially in hematology doctors and their fellow, maybe other hospital too. I'm not sure about what I'm doing is special, like we have a meeting with doctors to set up a new protocol for transplantation for our hospital. And sometimes we have to meeting with the director for about the insurance, how to pay with our transplant patient too.
Okay.
And also we have like inter-hospital meeting that because clinical pharmacy in Thailand just grow up. So whether how specialist you are, you have to have a connection with other hospital. And if pharmacists have more connection, maybe yours data is like more or very high level than doctor do. how can I say?
No,
like,
it's okay.
like for example, some medicine just used is new for you, but it's not new in other hospitals. So you can ask other pharmacists at how to use it, what I have to be monitored, and with this document, you can use it in your hospital. Like something is can crash or used for a GI tube or not. Yeah, exactly. Industrial not allowed, but you have a serious patient, so I have to need some like experience from other pharmacists in Bangkok to tell me.
Okay.
So I give this information to our team, and we okay with it. Someone can do it, and it's okay, so we do it.
Okay. And do you order the medicine, or who orders the
doctor?
Yeah.
Yes.
And then, but does the medicine come then through the outpatient pharmacy,
Yes.
or it goes through the inpatient pharmacy, just like here, in regards to when you're dispensing? Because you work in the same hospital, right?
Yes.
Yeah.
The doctor prescribe in computer and send the order to outpatient pharmacy, but but we separate to inpatient.
Okay.
But
you
in
do
US,
have two separate.
yes, how medication sent to community pharmacy is quite different. Yes, we have two parts, outpatient and inpatient. Yes.
Okay. Like, so, do patients get prescriptions from the doctor like they do here, and they can bring it to a community pharmacy in Thailand, or is that different too?
No. Go to see a doctor.
To the doctor first. Yeah.
Doctor order in the computers, and we verify it.
Yes.
And all the patient get is a bag of medicine.
Oh.
It's already finished.
Yes.
Oh, okay.
And we dispense to them.
If they want to refill,
yes,
doctor have to order like refill system or hospital system.
We have two options to see the pharmacy to refill in the hospital by mail.
Delivery. So then they'll mail it.
Yes.
Oh, interesting. Okay. And I understand that a lot of medications that are prescription in the U.S., you can buy them at the pharmacy, right?
Yes.
Can you give us examples of those? Like what might be some?
In retail pharmacy. Antibiotics.
Antibiotics. So you can just go to the pharmacy and buy antibiotics.
Yes.
And but so then the pharmacist really needs to know a lot.
Yes.
Which of course they do here as
the
well.
Guideline.
But
yes. What medicine that you use to treat them, or duration of the treatment.
Right.
Yes. The symptoms. Yes.
Okay. Very interesting.
Like for example, if patient got cold,
Yeah.
and maybe need a symptom medicine and antibiotic, you go to like drugstore or retail pharmacist here, and pharmacists in a retail store will like interview
Yes.
to be a doctor like that.
To add the symptoms.
Yeah, and pick the medicine and in the pack for you, and everything was set up. You just pay money and get the medicine. But if it's some restrict medicine like substance control, we cannot give you, or some chronic disease that just start. We cannot give you, so you have to go to see the doctor first.
Yes.
Okay.
But we cannot order lab like this, like you do.
Yes. To
check
pressure,
on
measure. Yes. Blood pressure and for
blood sample,
yes,
we cannot
order. We can do it.
Okay,
Yes.
so you can't order the labs, but you are able to provide the medications.
Yes.
That's very interesting. And how is the payment set up for pharmacists in Thailand? Are you paid by the government, or is it paid by the hospital or the retail pharmacy? How does that work? Who pays?
Who pays?
Yes.
We have about 4 insurance difference. The first one is government officer insurance is the best.
Yes.
Another one is everyone that get a job have a social coverage insurance.
Okay.
Insurance, yes.
The third one is everyone that is Thai citizen got it is universal coverage.
Scheme.
And the last one is cash pay. Cash pay for that you're not a Thai citizen, you have to pay everything.
Okay. So they either get the social coverage you said or universal coverage.
Yes.
Interesting. But if you're a pharmacist, do you get paid by the hospital?
We get paid by the hospital.
The hospital.
The hospital. Yes.
So it's not necessarily government run. Like, is the government paying all the doctors and pharmacists, or is that is the system like a private hospital?
In private hospital, or we work in medical school, the hospital paid salary for us, for all our staff. Yes.
Okay. So for you, you work for the university hospital, right?
Yes.
Okay. And so then that's how.
In the past, our university is government.
Yes.
But about 10 years ago, is not government anymore.
Oh, so it's
its
private
own pay.
now.
So that's why we moved from government officer insurance to social corporate insurance.
Yes.
Okay.
Yeah.
Interesting. And how many years of pharmacy school is it in Thailand? How many years do you go?
You have to study for 6 years.
6 years.
Yes, and graduate PharmD.
Okay.
Yes.
PharmD is 6 years,
6
just
years.
like here,
Yeah.
pretty much.
Yes.
Ours is like 4 years, but you have to do 2 years before that, at least a minimum of 2 years usually. For
If you have to get a board certification, you have to study for 4 years.
Okay.
Yes.
Okay. And so do you start pharmacy school right out of high school?
Yeah.
Yes.
Okay. So that's where the 6 years
6 years.
Yeah.
happens.
Yes.
Okay. And then you have residencies too, right? You can do a
Yes.
residency, yeah. If you want to specialize in something, just like here. A lot of similarities.
Yes.
A little bit different, but a lot of similarities.
Yes.
Are you enjoying your time learning so
Yes.
much? That's great.
It's a new experience and the first time to United States of America.
Yeah.
Yes, I'm impressed.
Yeah, we're impressed.
Yes.
Oh, that's great. Well, we thank you for coming.
Yeah.
And you've been able to teach other pharmacists about your practice and students too. So thank you. Anything else you want to say, or you just want to say goodbye? Hello to everybody back in Thailand.
Yes. Nice to meet you guys. And
สวัสดีค่ะ
สวัสดีค่ะ Welcome to Thailand. Yes.
Oh, yes. And we'll come visit you in Thailand. That's
Yes.
great. Well, thank you everyone for joining us today in our discussion in regards to pharmacy in Thailand.